The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hi folks, Dr. Fazil, you're watching 2025 November edition of Dr. Fazil TV show. Today we are going to talk about bone health. It's an important topic. We all made up of bones, muscles, and tissues. The bone is a building block, a skeleton, a framework. So we have to take care of it. If we don't, the body can scramble and we can have problems, fractures, dislocations, and weak bones. So we need to avoid all that, right? So folks, a call is prevention is new intervention. So having said that, let's talk a little bit about what is the bone made up of and everything. And while we're discussing that today, I will use the smart screen, a transparent smart screen, to explain my points here. So folks, let's start with first the bones. So folks, we have two kinds of bones. You can see here on the smart screen the skeleton. There's the axial skeleton, which is in the center of your spine, skull, all that. That's axial skeleton, axial skeleton. Then we have appendicular skeleton, which is your limbs, your legs, arms, shoulders, hips. We call them appendicular skeleton. The reason I'm trying to explain that early enough is that we check when we do a bone density test known as DEXA scan. And here on the slide, you can see the DEXA scan is a special machine using X-ray technology to look at the depth of your bone density. That's what we check. We call it DEXA scan. So folks, the bone is made up of, even if it is the axial skeletal or appendicular skeleton, it is made up of the three different components, actually two. One is calcium and one is collagen or protein. Collagen is kind of protein. This is like a mesh. You can see a cross section of a bone. You can see this mesh. That's kind of normal bone. And in another view, you can see this is actually a bone which is less dense, and this is like osteopenia. And this one is a little bit more porous. We call it osteoporosis. So I need to make sure that we do understand a normal bone density, osteopenia, and osteoporosis, because the treatment and guidelines is different for each phase of the bone loss. I mean, this is for the normal patient with the normal kidney function. The patient who have kidney problems, they have a different kind of a bone loss or bone condition. As a matter of fact, there are dozens of other bone conditions like rickets, osteomalacia, renal osteodystrophy. I don't want to confuse you guys because those are rare and not common in the general population. So we'll leave it for another day. So today I'm going to talk more about the things which are most common, osteopenia and osteoporosis, right? So let's talk about what does the bones made up of. We did discuss calcium and protein, collagen, and but to make bone, you need two other things. Number one, there's a vitamin D, and then there's a hormone known as parathyroid hormone, PTH. This is not the thyroid hormone. It's different. You can see this is in the neck. There are 4 little glands, 1, 2, 3, 4, embedded in the thyroid gland, and they actually control the calcium and phosphorus balance in the body. So if you have a high level of that, it can also damage the bone by losing calcium. So that's the kind of general overview of how the bones are made. Plus, there's one more factor: gravity. So gravity tells the body to make more bone. It is important. Gravity is important. And it's a very common saying when the astronaut goes in the space for a long time, you can see this astronaut is up in the air in the space and is getting taller. And as they get back to into the ground on the earth, when they're exposed to the gravity, the bones become shorter, and also obviously because they have more gravity, but they also become stronger as well. So typically, if they are in the space mission for a longer period of time, they do some kind of weight-bearing exercise. They have obviously artificial gravity there on the machines they use to exercise. That can cause bone to stay intact, but they still lose a lot of bone depending on exposure to lack of gravity in the space. The longer they stay, the more bone they're going to lose. So gravity is important. And the reason I'm saying is that as one of the treatment for the bone loss is weight-bearing exercise, not cardiovascular or anything else. That's important too. But as I'm saying, for the bone strength, gravity is important. So adding extra weights around your ankles, walking with like with just the typical weights. You can see this right here on those digital display. There's some weight wraps around the ankles on the wrist. If you have a bone problem and if you want to add something more what you're already doing, like taking calcium and vitamin D, you can add those kind of weights when you do walk or do normal exercise for a period of time every day. And that's why people who are bedridden for a long period of time, they lose a lot of bone. And again, it's important because you have to know that at a certain age, if you fall and if you fracture your hip, the mortality, that means the risk of dying, is 90%. So it's not really unimportant. It's very important to first, hey, don't fall, and B, if you fall, don't break your hip or anything else. And you will do that if your bones are weak. So obviously protecting bones are important in one fashion or the other fashion, right? So let's talk about guidelines, parameters, definitions. So we use two terms, osteopenia, osteoporosis, and normal bone. And we use two kind of scales, like two kind of numerical scales, T-score, like I'm writing T-score, and Z-score, right? So Z-score is less commonly used, so let's talk about T-score. T-score means it is your bone against a younger person of 30 years age with normal bones. So Z-score is with your own age appropriate comparison. So let's say Z-score is orange to orange, and T-score is orange to bananas, if that makes sense. So the trick is that what are the scores? 1 to 1.5 is normal bone, like normal bone density. The more negative it is, the more bone loss you have. So we have up to 1.5, minus 1.5, that's your normal bone range, normal bone density. Minus 1.5 to 2.5 is osteopenia, and minus 2.5 and downwards up to 3.5. Minus 3.5 is osteoporosis, and more than minus 3.5 is severe osteoporosis. So this is the T-score, T like Tom, I guess, and a T-score, right? So every time I ask about your T-score, and then we compare when we check it again to see if the T-score is getting better. So if it was 2.5, now it's minus 2.4 is a better score. The lower it gets, the better it gets, right? That's how you understand this concept of bone density, checking with bone DEXA scan, and how the T-score is compared.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
When should we start checking it? All post-women, female, especially age 65 plus, that's when you start checking it for bone loss screening. Men 70 age plus for bone loss. And then there are special cases which you can start early. Let's say for age 50 plus, if you are very thin, risk of fractures in the past, smoking, alcohol abuse, or excessive use of alcohol, or exposure to excessive amount of steroids, then you can start doing checking early. And then you recheck in 1 to 2 years based on your numbers. If the numbers are really bad, then you check early. If you're stable, then maybe 2 years, and then go from there. So these are like general guidelines. Number 2, we have, okay, now we know when to check, now how to check. So check based on age and your risk factors. And B, check, so we're putting numbers here, 65 plus women start first time checking, 50 plus women, postmenopausal, steroid risk, alcohol, lean body mass. If you're thin, actually, you're high risk for bone loss. Smoking, alcohol, family history, right? Multiple fractures for no reason. That's your risk factors. Men, 70 plus, and 65 plus, again, if you have risk factors just like that for females. Obviously, not the menopause state doesn't apply to men, but every other factor stays the same. So that's like how you do it, when you do it, how you do the interpretation. Let's talk about like symptoms. Symptoms are generally bone pain. It can also cause spontaneous fractures or fractures with minimal injury. That's symptoms. When we check, is confusion why we check and do different parts. We're not checking hips or we're not checking your lumbar spine. We're checking axial skeleton. We talked early why we check, why it's important to understand. So your axial skeleton, we take a sample of that lumbar spine, and then we also take one of the hip for appendicular spine, a skeleton, appendicular skeleton, right? So then we have two different, because those two bones behave differently. But you go with the worst one. So if you have a bad on the hip and normal on the spine, we go with the worst score. That's how we're going to treat you. Not like hip is treated separately or spine is treated separately. So we go with the worst one. Let's say you have minus 1.5 on the spine and minus 2.5 on the hip, we will treat you as osteoporosis. So that applies to the whole body. So we don't need to check every single bone, but we check just the sample, spine, and the hip. That's kind of traditional. Back in the days, they used to do for finger. I'm sure they're still doing it. That's a portable machine, small machine where you can put the finger in there. They can check it, but I don't think it's too accurate. So I recommend just doing the traditional bone density with the DEXA scan. Treatment, again, the treatment is, again, avoid the risk factors, alcohol, smoking, weight-bearing exercise. Avoiding too long stay in the space, obviously that's a joke, but I'm sure it's not a joke for the astronauts. That's a important profession, important job. So they're serving the country and the humanity, but they put themselves at a risk. And this is one of the risks they have, besides many other, is bone loss. Swimming will not help actually, because that's actually not a weight-bearing exercise. So if somebody's saying I'm doing too much swimming, actually this is the opposite of having weight bearing. Is less weight bearing. You might have a cardiovascular buildup or muscle buildup, but wouldn't help the bones, right? Because you're defeating the gravity. You're floating actually, or not as heavy as you would be if you are outside the water. Vitamin D and calcium. The recommendation is vitamin D3 or D2. I think D3, D2. 1,000 units a day, international unit a day, 1,000 to 1,200. And then let's do 1,200. It's easy to remember that way. 1,200 units, i.e. international unit twice, divided in 2 doses, 600, 600. And then calcium likewise, 1,200 milligram per day. That would be your calcium. And so that's kind of how you, and then you check it when the time comes again and see if the treatment is working or not. Again, there are other treatments too for like a bone loss. For example, if you have osteoporosis, there's a medication group known as bisphosphonates like Fosamax or Eldronate, one tablet once a week. And that's also used for osteoporosis prevention or treatment, as a matter of fact. And then protease shot every 6 months. That's somebody who cannot tolerate Fossa Max, they can go with Prolia. And there are other options too. I mean, again, this is a lengthy topic, but those are like 95% of the treatment, which I just gave it to you. Folks, I have a robot audience in my TV show today. We'll call her Claudia Robot. And Claudia Robot, you can come up to the stage. Here you come. Well, one thing, good news is that she's going to ask me some question. Another good news is she doesn't have to worry about her bone loss. She's made up of metal. So it's good and good, right? There's no good or bad. So Claudia Robot, do you have any question for me?
What is the difference between vitamin D2 and D3, and which one is better?
Well, that's a very good question. So actually, D2 comes from plant, D3 comes from the skin and animal source. So typically, vitamin D3 is better. It's more stronger, more active. So if you have an option to take D3, go with vitamin D3. Good question, Claudia. Another question?
Is Prolia the only injectable medication, or are there others?
Well, there are different ones. There are some shots which you can once a year. Mostly they're not covered by the insurance, so I tend to avoid that. Prolia is also difficult to get authorization, but still we get it.
Which type of calcium is better for you?
Yeah, that's a good question. So there are calcium citrate and calcium carbonate. So calcium citrate is better because you can take it with or without food. Calcium carbonate you have to take with food, and calcium citrate is more stronger. Less side effect, more stronger. So if you have an option to take calcium citrate, might be better. Good question. So folks, on that note, that was Dr. Fazil TV show. I will see you next month with more useful topic for your health. And God bless you, God bless America. Thanks for watching Dr. Fazil TV show. Thank you.